Christine here, and today's video, I want to really be frank with healthcare business owners. And I've created, and I've been sharing my here on YouTube, for example, about healthcare leadership and operation with this incredible community, the channel, and also liking my videos, for example. But today is different. This video, it really is different because it is about me, staff, for example, and want to really build something significant, but you feel like you're being pulled down and you're drowning in the operations systems and looking after the operations side, but spending more and more time managing the operational chaos than building your vision. If you feel trapped like I did by your care CEO anymore, I've become something much more than that. You see, the healthcare operations have become really complex that would transform how your small to medium or large healthcare organization business actually functions and operates as well. So let me tell you a bit about with substantial teams. Then over a decade helping other healthcare business owners scale from small practices to major operations. And I've been on, for example, that you've got 50 to 400 plus staff, for example, operations that are running from 5 million to 50 million, for example, annually, entrepreneurs who've been fighting all the time. So when you're running a 50 plus staff business, for example, you know that the operational side of it is complex. Every decision impacts dozens of or hundreds of people and thousands of service users and patients if not done. So let me tell you a bit about who I am and why. Over a decade helping other healthcare business owners scale from small practices to major operations. And I've been on YouTube for over a decade as, for example, operations that are running from 5 million to 50 million, for example, annually. Entrepreneurs who build substantial healthcare enterprises but feel like they're managing business, for example. You know that the operational side of it is complex, right? And it's just bigger. It's exponentially more complex. The bigger thousands of service users and patients, if not done. That's why I've created the AI agents to help you and your organization with operations. Because let's face it, a business coach, I am specific and I have created a specialized solution to help you, the business owner. So here's one operational complexes. So when I had 10 to 20 staff, you could manage everything perfectly. But at 50 to 100 staff, you're managing managers. So you built something amazing. And I take my hat off to you. Well done for building a business which has reached 5 million to 10 million to 50 million annually, how I felt. And with the current economic pressure, government funding cuts, staff shortages, rising operational costs, running a large healthcare operation, just hire more people. I thought I could just hire more people. Hey, I'm getting bigger, just hire more people to solve the operational framing. You need a systematic, automated, tell you this now. I built it because I started with a promise I made to my 15-year-old self. I promised my father that I would be a millionaire, and I wait, but I achieved it. I started my healthcare business back in 1992, for example, and by the third year, for example, I made 1.2. I achieved the dream. The grand house, the Victorian villa in Sussex. The house even had a name to itself, Norfolk House, which was named after the Duke of... I was paying £30,000 a month alone on office salaries alone. And I'm not referring to those that are delivering the care that were doing a substantial... But here's what no one tells you about achieving your childhood dream, which was my childhood.